Okay, so now we're getting ready for the coloring phase, which of course is very important, but not necessarily more important than the finishing, in my opinion. And I'm going to utilize the Origin Live liquids here, and these in particular are the Origin version 6.0. And if you know the Origin materials, each version comes in 3 different strengths in all 16 shades, so there's a lot of choices. What I have found with the Vericore materials is that the version 6.0 70% is my base shading material. I can dilute this a little bit for the different zirconias. For the Pro Zirconia, which we're coloring today, I will generally use the 70% liquid, 5 cc's of liquid to 1 cc of water, which amounts to about a 20% dilution. That I use for that. If I'm doing the HTX material, I will use it straight, and if I'm using HT material, which is higher strength, I will dilute it 30%, which is 5 cc's of liquid, 4 cc's of liquid to 2 cc's of distilled water. And I'll show that. There's another way to skin this cat also, as far as getting the right mix for the different zirconias, and that is to purchase the 70% and the 80% in the shades that you want to use. And in that case, the 80% straight works perfect for the HT material. The 70% straight works perfect for the HTX material, and a 50-50 blend of the two is perfect for the new Pro material. And so it's your choice how you want to proceed, and again, you can change these ratios a little bit depending on the results you get, but for me, I use all the 70% and I just dilute with distilled water as needed for the different materials. And I will talk, we'll definitely have a little chart for that for you in this video, so you'll see how that's done. You don't really have to remember that. Again, probably to me the hardest thing to get is a good incisal, and I like the Origin 1.5. They make a 2.0, a 2.5, and a 3.0 that are progressively lower in value. In my opinion, as they go higher in number from 1.5 to 3.0, they become too purpley. I don't like that so much. I really don't like that look. And so I make my own out of their 1.5, and then I modify that for different value situations with the 3M gray effect shade liquid. And again, this is a personal thing. I'll show you this. You could try it. And again, I like it after trying everything I can get my hands on. And then the third thing that we want to utilize is some sort of colorant to basically identify our liquids as to what they are. I like McCormick Food Color. These are my 4 basic hues that come in this little package. I use reds for bodies. I use blue for incisal. I use yellow just to tint water if I'm going to use that as an inhibitor, and I'll talk about that later. And green if I've got something else that I want to do, some kind of a modifier that I want to use, I'll make that green so I can see where I put it. So for today though, because we're going to use a base shade, we're going to do an A2 crown, we're going to use a base shade, we're going to use a chromatized shade for cervical areas, and a highly chromatized shade for occlusal morphology, for the orangey look or the high chroma look down in the central fossa and in the developmental grooves. So for this crown, which is A2 base, we're going to use A2, A3 for the more chromatized areas, and A4 for the lingual pits, and the anteriors and the occlusal grooves on the posterior crowns. So we'll use 3 shades to get what we want to make an A2 crown. Materium, number 4 stain brush, an old porcelain brush, and then a marker, right, a Sharpie, and a plastic forceps. Now, before we start, we need to clean out any loose debris. I don't think you should ever use your compressed air. It has contaminants in it, you never know. My compressor is not an oilless, so I do have an oil filter on it, but I really don't know exactly what's coming out of there, and for this it's not worth the risk. So, you know, I've already done this, but I'll blow out the primary dust, and there should be none left. And I'll typically do this while it's still in the puck and I have my suction on, okay? Blow it off really good with the canned air. But before we color, make sure you take your porcelain brush and go inside and make sure that no white clouds of dust come out or come off of this. Zirconia is really sticky, and you can't blow it necessarily all out. And of course, these I've already done. You're not going to see any clouds of dust coming off, but you will know what I'm talking about. You'll see these clouds of white dust. Just make sure that you have gone over this once you've blown it with a little brush to make sure there's no loose dust in these units. Okay, and then we're going to start with the molar, then we'll do the central, then we'll do the bridge. The technique is very similar, minor differences, which we'll point out as we go along. Alright, so again, we're doing an A2 crown. The molar, the posterior is probably the most complex coloring, although I've tried to make a simple technique that works really well. We're going to do it in sections. We're going to use our medium incisal. We're going to use a chromatized, one shade darker. We have our primary body shade and our ultra chromatized A4 for this A2 crown. You can use A3-5. It depends on what kind of chroma you like on your occlusal. That's where we use the A4. So it's really a step-by-step process, and I've made the chromatized, the A3 in this case, green so you can see it. Body shade red like normal, and I tried to make the A4 orange by mixing red and yellow. Didn't work so well, but it only goes in one place on the occlusal, so that won't be confusing. So what I want to do first is start with just my chromatized areas, and these are just basic coloring guidelines everybody has. Chromatized areas, developmental grooves, cervical, and that's pretty much it. Developmental grooves and cervical, okay? And on an anterior, lingual pits and cervical, and then on a bridge, it depends on what that is. So the first thing I want to do is hit up my chromatized areas, okay? And again, this is one shade darker. It's only in those areas that tend to be slightly chromatized, and again, my sponges here. You only dip, so I will dip in my thing, blot it out. Well, first I make sure my brush is clean in the water. Okay, dry that off in the sponge. Pick up some color, blot that out. So anything that was in there is gone. I've now got the brush. I got the water out of the brush, so it's just liquid. Now I'm going to pick up what I want to use. Okay, which again, half the brush dipped in, kind of, and I'm developmental grooves right down here. Okay, a little bit of the chromatized developmental groove back here. Okay, and then around the cervical. And again, you don't have to do this if you don't want a little enhanced color, and you feel like you can't be doing this for time or whatever. Fine, but if it's not a big investment in time for the what you get back, and also run around on the inside. Okay, just one coat basically around the crown, inside and out, just a cervical a little bit. I may go around here maybe a little bit extra. And again, we found that this liquid penetrates really quickly. Done. So those are my chromatized areas. Pretty basic, everybody knows this, but we want to do kind of what's natural. And now our main shade for this is A2. I want to do my lateral segmental. So if you want to add a little more realism to your crowns, typically we have a little bit of finger of color coming up on the height of contour on the primary cusps around the crown. And you could do this or not. I dip, blot, dip to make sure that previous color was out. My brush is clean. And I just want to come up right through this height of contour on this cusp tip, and a quick little brushes like this. Because a little finger of color that breaks up our incisal is nice. And I normally don't bother on the lingual, okay? I don't. In this case, I add a little bit up here for comparison, but that's about it, okay? Just real quick, again, that's my body shade. Most people know about what we call the lateral segmental technique, which means we build different colors laterally across the occlusal or incisal of the crown to break up the color a little bit. And that's what we accomplished here. So the first step is the chromatized areas, the lateral segmental areas, nothing on the occlusal really yet, and now we're ready to start with our incisal. Because what we want is to create contrast. The only way to see opacity is to put something translucent next to it. The only way to see a light color is to put a dark color next to it, create contrast. And that's what we want to do on the occlusal to create some depth. So the best way I've found to do that is to start with incisal on all of your ridges. All right, and again, I'm going to clean my brush. I'm going to dip it. I'm going to blot it. I'm going to dip it. And then maybe twice, and then I'm going to go just the tip and start doing this. So this is just accurate laying of color. So I want to just hit my ridges. Okay, just my ridges that are here. And the more accurate you want to do this, I think the better. But just stay right there on this primary anatomical features. Right, and across my ridge. And remember, the areas, we're leaving the areas that we want to be chromatized untouched. So my marginal ridge, and that looks pretty good. And then I want to do my outer facial surfaces. And again, on the first coat, skip these chromatized areas. Just skip over them. Because we want to see this. We don't want to cover this with incisal and basically dilute out too much that little bit of color. And how far down you go depends on how much translucency you want in your crown. So this being fairly generic, it's like maybe a third of the way down. Okay, so there's one surround. And now let's do this again and try to be a little accurate here. Just hitting the ridges on the occlusal. Run around real quick, second coat. And you may find that you like one coat. Try it. Okay, I think you really get a pretty good incisal enhancement with one coat around these, but I'm a creature of habit. I've gotten to where I like two, and so that's what I do. So around the marginal ridges, and now this time we're going to come across our buccal or facial, and again same thing, but this time I'm going to go over this chromatized area because I don't want just body coming up, but I want to see a little distinction between those areas that helps just break up the crown and define our colors a little bit. So that's that. Okay, that's all there is to it. And now we're going to add our chromatized, highly chromatized porcelain, which in this case is A4. You have the choice. There are modifiers. Origin makes a brown and an orange and grays and violets that come in little drippers. You have all kinds of modified colors for zirconia. I just kind of like to use something in the same shade group, this case A4. And again, clean it really good, blot this out, and we want to get just a little bit of our brush and touch and let it run. Just touching the pits, right, and let this run. And if you have to paint it to get it into these little secondary grooves, fine. Okay, but I'm going to touch around probably 2, 3, 4 times, and you'll be surprised. You think you're putting just a ton of color in here, and you're really not. But you can see, and part of the reason that I like to enhance the occlusal morphology is because it allows this to run. And I got a little incisal in there, so that's good. I like it. So that's finished. For the highly chromatized area on the occlusal only, and on anteriors we'll do the lingual fossa with that, and then now I'm going to dip it in my main body color. And you want to move fast because this has to be wet. This crown has to be wet so that this liquid doesn't really go in and overpower our incisal. Now, if you get called away, if you want to show this incisal a little more, this is just distilled water mixed with some yellow food color is all this is. And you have the option, if you got a phone call, you stepped away, you think, this might have dried out a little bit, no problem. But we still don't want too much of our dip color to go in, especially the incisal area. So you can take this water, okay, and just paint it back on. Okay, these ridges and stuff to re-wet them, which I don't need to do in this case, in order to inhibit some of the body color we're going to dip from going in there. So this is, you can use this as a technique to see more of the incisal and less of the other color coming in. But if you do it quick, this is not going to soak into the areas that are already wet, so it's normally not necessary. Sometimes I'll actually take my incisal. Let me just open this up again. And again, it depends on what you want. And again, water, dip, blot, make sure I brush clean, and add a little extra to my cuss tips, and and a little extra around the perimeter of this part of the crown here. But again, not necessary. I normally don't even do that, but it's an option if you like a little more incisal look. And then we're going to dip into the A2. And again, this is something that I don't think anybody really teaches. It's not necessary. You want to dip for 5 seconds, and that's it. And there's some real advantages to that. So when you take your crown and dunk it in, right, 2, 3, 4, 5, take it out, shake it off, okay, and blow out the excess that might be in there. And again, using canned air, and that's it. Now, interestingly, we did a whole lot of testing on this as far as the dipping goes. Most manufacturers recommend between a 1 and 2 minute dip. We tried a lot of zirconias, a lot of colorants, everything on the market we could find, and discovered that there was absolutely no difference in chroma intensity from 5 seconds to 1 minute to 2 minutes. So everything you need is in there, and the advantage to doing a quick dip is that on situations like a bridge, where you can get in trouble because you'll get more chroma in the pontic because it's pure thick zirconia. If you dip too long, you will over-chromatize. With a 5-second dip, you don't have to put inhibitors on the pontic. You don't have to worry about that. It will come out nice and even automatically. So that really is the process for doing posteriors. Alright, so now we're going to do the single anterior. It's the same general philosophy and theory: chromatized areas, highly chromatized areas, incisal, and lateral segmental. Okay, so again, everything we're doing today is A2, so our chromatized areas, which are the cervical, and maybe the lingual pit, although I'll do that highly chromatized, I think, like I do the occlusal, is step 1. So again, I'm going to dip in, blot, and I'm going to move over here so I'm closer to my sponge. And I used green, which I normally don't do, just for the demo, and this just to run around the cervical. And once around on the inside, on the outside, and again, don't get hung up with being too accurate here. It's just a little bit right down here, and it'll kind of soak up the crown a little bit, and it'll. And again, if you have a crown and you got a photo and it's much darker here, adapt accordingly. Okay, but just for a generic crown, that's it. And I think it's worth the time to get a little bit of chroma there. I don't want to stain any. If I can do nothing to this crown except polish it after it's centered, because I did a good job designing, my occlusion's right, everything's good, and I get it colored, man, that's a winner. Okay, I really don't want to be messing with centered zirconia. And again, I want some another chromatized or highly chromatized area in the lingual fossa. So in this case, I like good contrast. I'm going to use the A4 in this. Again, it's an A2 crown. It's 2 shades darker. And I'm just going to put it right here, just in the lingual fossa. Right there. And that's it. Boom. Done. And it soaks in pretty good. You don't spend much time here. Just put a little something there. Again, this is a small investment of time for a nice effect. Optional, though, your choice. And then we have the lateral segmental idea, which helps break up across the incisal edge in this case. Again, our body shade, A2. And this is a generic approach. I'm going to come up from margin all the way up through the height of contour in the center of the tooth. And maybe, put a little something in this little fossa here, maybe a little something here, just to break this up. A couple strokes, that's it. And then if you want to see more, do another little addition. It depends, you can base this on photography, you can base this on your artistic flair, whatever you like, okay? Or you could not do it. You can really simplify this technique to just incisal and a body dip. It's really not a big deal. But if you do, I suggest always do the incisal before your body dip. That's the secret to getting a good contrast between the incisal and the body shades. So we're going to do the same thing we did before. We're going to, dip it, blot it, dip it to make sure we got pure liquid in here. And just, again, how far down you go on these marginal ridges is depending on what you want. I skipped the chromatized areas on the first coat, just coming around with my incisal. I like to hit these ridges a little bit, a generic thing, maybe halfway down interproximally. And then on your marginal ridges in the back, go almost all the way down across the incisal and catch about 2/3 of these ridges. Come on around, and then second coat, cover everything. And again, I see how I sort of jab at it like this. I don't want this line straight. I want it irregular. Is it a big difference? Nope, not really, but it's a little more natural if you don't have a straight line of demarcation across. And again, here, just a second coat on these lingual ridges, across the incisal, across the interproximal, and I'm done. I can add a little extra across here. You can actually take some body and put it across here if you want a small border. You could have done that first. Put the A2 all the way across, thin, and then you'll see a little border of body color, which is what borders are. They're typically body color. And that's the end of the coloring on that. And now we're going to dip. Again, A2 Pro, 5-second dip. Seems like it's not enough, but trust me, it really is. Plastic instrument, never meddle in the stuff. 2, 3, 4, 5, out, shake it out, and then grab it and blow out the excess. Hence why I keep my paper towels here. Blow it off. And this isn't critical. Trust me, everything that you want to go in goes in. I just like to get it off to stop that because I really want to see where my incisal was. I want to see where my chromatized was. I want things to do what they're supposed to do and not overpower each other. So there is those two so far. And to, drying these before we sinter, I think you should in a toaster oven. It can, the fumes, the vapors coming off are acidic. They can mess with your heating elements. These should be dried. If you're doing a lot and they sit on the countertop for half an hour, 45 minutes, they're probably pretty dry. But just never go straight into the sintering oven. With 1 or 2 units, but over time it'll still make damage. So I would recommend making sure you dry these before you sinter. So the last thing we want to do in this video is a bridge, because there's a few differences there, and you can see that some of the coloring has transferred from my finger. This always happens, and trust me, that doesn't matter. It's not going to affect anything. We want to, same approach. We have chromatized color, we have the main body color, we have ultra chromatized, and we have our incisal. So I'm going to start with the chromatized, which in this case is just 1 shade darker, again, A3. And the first place you want to go is right under your ponic. And this one, you want to soak this baby, okay, under here, and really glob on some color. 1 shade darker. And I'll just puddle it on here a couple of times like this. Good. All right. Now we also want to, follow average coloring schemes, which creates a little more chroma interproximally. So we're going to use just, again, the chromatized. And try to come right in here and let it run up that groove. I'll touch it, because usually it spreads out down here, so I'll touch at the cervical and let that color kind of run up that little groove that we enhanced with our Wagner little disc, and carry it around on the lingual, okay, a little bit. And again, I'll let gravity help me, so I'll dip a little bit and touch right there and let it run in this groove. That's that. Now, as far as what you're going to do in these lingual fossas, I think sometimes just 1 shade darker is adequate. I think 2 shades, like we did on the occlusal of the molar and in the lingual fossa of that single central, gives a little more contrast. You may choose to do nothing, because after all, this is the lingual. So this is mainly because I like it. I don't even, and I think doctors like it too. But no big deal. Just blot a little bit right here in this lingual fossa area. Right? And that's about that. That's going to give us some nice warm chroma in here. It's just going to enhance the contrast of the crown. So, and then, apologies, we should have done this at the same time, so I didn't have to open 2 jars, but same exact technique. The chromatized 1 shade darker also goes around the cervical of all of our units. Okay, so I want to run around the cervical and inside and out. And when I pass by the underneath my ponic, I'm going to hit it again. I mean, this is an area that you could really kind of want to get some color on. And this is not, none of this is really critical. It's really more the philosophy of the approach, not the precision of the placement that's really important. It's just to get some contrast and some variety going on. And again, if you go around, you know, 2 or 3 times, that determines kind of how much chroma you get, but it doesn't make a big difference going around and around and around on those areas. And then again, this is an A2 crown, so we want to do our lateral segmental on our facial. And I am trying to blot my finger. That's one drawback to the finger cots, is that it's a little bit of liquid that gets on here, gets on there, but I've never seen it be enough to cause a problem. So it's not really concerning to me. Again, my lateral segmental, little line of color coming right up this center, height of contour. And again, this is generic coloring, okay? You can modify this based on what you see in a photograph. We can actually add, let's say, some dark incisal in here if I want to, like, try to do a little lobe formation. There's a lot of things you can do with these colors, but I'm really only trying to give a little bit of a rather generic breakup or lateral segmental idea, okay, on these teeth, and in this fossa, maybe a little bit of body color, okay, like that. Done. Okay, for our lateral segmental. And now we're going to do our incisal exactly the same way we did it on the single central, and did it on the molar, and do it on everything, which is, first pass, you skip your lateral segmental areas because you don't want to overpower them with the incisal. You want to see a little bit of something there. And the second coat, we cover it. So I just go right in between, get my incisal edge, you know, or not. Maybe I carry this all the way up like I did in the middle. That's, you could add a little variety. Again, how far down you go on the facial here determines kind of what you want to see. And if you mess up and go over it a little bit, don't sweat it. I mean, like I said, this is not critical. It is just an approach that, you know, a little bit of variation actually looks good when you have a little bit of asymmetry in the way that you do these things. So again, it's not, I don't spend, you know, I don't get hung up on precision necessarily, just approach. So first coat around, again, where you go here, some people like to put some highly chromatized down in here. That's maybe not a bad idea. And then my second time around, I'm going to cover my lateral segment a little bit. Down here, maybe yes, maybe no, depending on what I want. Try not to make it too much of a straight line across. And do it in vertical stripes with your brush, so that you create a little bit of unevenness where the incisal meets the body. A little extra on the incisal edge, and we're almost done. Good. And, you know, if I want to, I can, you know, do whatever I want here, but that's sufficient for what we're doing. A little something here, maybe. Okay, done. And then we're going to dip this. Again, 5-second dip into the body shade. Keep moving. You want everything wet so that things stay where they are and don't get replaced by the next layer that we're putting on. So if time got in your way, go ahead and maybe wet your incisal a little bit. But again, we're going to go in 5 seconds or less. Being a bridge, blow this off to stop the process, especially on the ponic, because I don't want the ponic to get over-chromatized. And there's our bridge. Don't forget to snap the lids on really good and make sure they're down. If you do that, this will be airtight, and these liquids will last a long time. Because like everything else, nothing's cheap, and if you can conserve it, I'm all for that. So that's the coloring technique. So now we've dried these in a little toaster oven, right? So all the liquid's gone, all the moisture's gone. We've got them in the sintering tray. You know, always let's cover that. I think everybody knows that. And then we're gonna center this 1500 degrees. I'm not gonna go over the program. That's all in the instructions. Okay, now pick the program. This is going to be Pro Singles Program 6. And start. Done. And off it goes. Now, so, you know, we get the results we expected. This technique is really quite predictable. I think the shades, we'll look at these more closely in a minute. But you can get a feel for coming out of the centering. They center at 1500 degrees. 2 hour time. There's a program that I'm really not going to go over right now. So let's take a look a little closer and sort of analyze what we got. Yeah, well, I mean, you know, we have what we want here. We have, if you can see it, let me see, you know, just a little bit of lateral submittal coming up, a little enhanced incisal coming in here. We have like a nice natural look. We have a little bit of chroma here in the lingual fossa. Good incisal contrast going on. Same thing here. We have very subtle what we wanted. Would I say that our green state finishing was perfect? No, not great. If you didn't like it, you can always go over this and then repolish. On our molar, we have some nice warmth in the occlusal. We have our incisal where we want it. We have a nice contrast of body versus incisal here. Not a ton of color cervically. None of this is meant to be stark. It's meant to be subtle and just give a little nicer look to your zirconias that you do routinely. That would be about it.